Thank you very much for joining me, Lucy. Lucy, can I ask you, I don't see how increasing the salary of an ambulance driver by even 10 or 15% makes it more likely that they should get to an emergency incident on time.
Well, I don't either, but at the same time, there seems to be a sort of standoff by the Treasury, which needs to sort of stump up the money, and the unions. And the more the talks aren't being constructive, the more we wait and the more patients are being put at risk in probably what is the worst NHS crisis in history, or at least one of the worst. So it's not just about pay. If you talk to staff, they are, a lot of the work that they do does rely on goodwill. That's why they go into the job. And I think a lot of them are fed up with the conditions, which are down to the unsafe working practices. The NHS is in a terrible state. OK, so I think I agree with you completely on the idea that if people are happy to go to work, then they're more likely to work and less likely to be complaining all about pay. I do understand all of that. What can be done to increase the working conditions to make them more preferable in our NHS? Because it can't just be about the pay. There's got to be something else to it as well. If you look, there's a number of things that we've talked about, but I think probably the biggest problem in the NHS is about capacity and the delayed discharges or bed blocking, and that is the real issue there, and that needs to be fixed. Throwing money at it and putting people suddenly in hotels and trying to put them in care homes all of a sudden, which has been, a recent move, is not going to fix it. And so until we really grapple with that problem and perhaps even put the NHS, which takes about £160 billion a year,
right,
and the social care sector, which only gets about £30 billion a year, until you put them together, there's going to be no vested interest in them really working together. Yeah. It's like an engine and a gearbox. They need to work together.
Well, Lucy, I find this, and whenever I talk to representatives from the BMA or junior doctors or nurses or ambulance workers, there seems to be this almost bizarre, warped view that everything that we've got at the minute is terrible, but everything that we've got at the minute is sacred. So we can't actually have the kind of radical change that we need in our NHS, which is why when I say to people, well, you're training over here now at the taxpayer's expense, using a student loan to become a junior doctor, and then at the first opportunity, you're moving to Australia. And now, as I understand it, I spoke to a guy from the BMA earlier, he told me they don't have to pay that loan back, which sounds a bit cheeky, to be perfectly honest with you, as far as I can see. I'm not sure the British taxpayer will be that happy about that. But why don't we just copy what the Australians are doing then, if they're all moving over there?
Well, I agree with you. The NHS, it's like a cult, isn't it? And you can't have a conversation, it's a red line, about completely reforming it or changing it. But it was set up, as we know, in 1948, and it was set up for a population that was born in the 19th century, and it doesn't work anymore. So we need to move beyond this, and we need to have serious discussions. That doesn't mean to say we need to have a private health system or any other particular system, but it doesn't work at the moment. So we need to change it radically.
Lucy, just very finally, is population growth the elephant in the room here? We don't hear enough about this, I think. Gosh, we've got so many more people using the NHS. Where have they all come from?
We have got population growth, and at the same time, I think there's been over a 50% decrease in beds over the last 20 years. And it's not so simple to just say more beds, because we haven't got the infrastructure to put them there, and we haven't got the staffing to look after the people in beds. But if we can sort out people before they get to hospital in the communities, if we can have a better GP service, then we can catch them before they fall, in inverted commas, and they won't need to go to hospital.